Is erectile dysfunction all in your head? For many men, this issue can be a significant source of embarrassment and frustration, leading them to question their masculinity and overall health. However, with a better understanding of the underlying causes of erectile dysfunction, we can separate fact from fiction and find effective solutions for this common condition. So, let's dive in and explore this fascinating topic together. Before I dive in, don't forget to hit the subscribe button and turn on notifications for this channel. There are valuable videos on this topic that you won't want to miss. And be sure to stick around until the end for our recommended, simple, easy exercises that drastically increase stamina and heal erectile dysfunction from the privacy of your home. Now, let's get started. Erectile dysfunction, ED, is a common condition that affects millions of men worldwide. It is defined as the inability to achieve or maintain an erection sufficient for sexual activity. There are many factors that can contribute to ED, including physical health conditions, such as cardiovascular disease, diabetes, and obesity, as well as psychological factors, such as anxiety, depression, and relationship problems. While physical factors may be the primary cause of ED for some men, there is also evidence to suggest that psychological factors can play a significant role in the development and persistence of the condition. In fact, many men who experience ED also report experiencing psychological symptoms such as anxiety and depression. The question of whether ED is all in your head is a complex one, and the answer is not as straightforward as many people believe. So, what does this mean for men who are experiencing ED? It means that it is essential to seek medical help to determine the underlying cause of the condition. By addressing any physical or psychological factors that may be contributing to ED, men can improve their overall health and well-being, as well as their sexual function. There are 3 different types of erections: reflexive, nocturnal, and psychogenic. Each type of erection has its own distinct mechanism and purpose. Number 1. Reflexive erections. Reflexive erections occur in response to physical touch or stimulation. When the penis is stimulated, nerve signals are sent to the brain, which triggers the release of nitric oxide, a chemical that relaxes the smooth muscles in the penis and allows blood to flow in. This increased blood flow leads to an erection. Reflexive erections are important for sexual activity, as they allow for penetration and sexual pleasure. For people with erectile dysfunction, reflexive erections can still occur even when there is an underlying physical issue causing the dysfunction. This means that even if there is a problem with the nerves, blood vessels, or other structures in the penis, reflexive erections can still happen. By understanding this mechanism, doctors can use various treatments to help facilitate these reflexive erections. Number 2. Nocturnal erections, also known as morning wood, occur during sleep. These erections are typically brief and occur during the REM, rapid eye movement, phase of sleep. Nocturnal erections are thought to be a result of the body's natural process of maintaining the health of the penis. During an erection, blood flows into the penis, which helps to oxygenate the tissues and keep the penis healthy. For people with erectile dysfunction, monitoring nocturnal erections can help doctors determine whether the cause of the dysfunction is physical or psychological. If a person is experiencing nocturnal erections, it suggests that the physical structures of the penis are functioning properly. And the dysfunction may be due to psychological factors such as anxiety or depression. Number 3. Psychogenic erections. Psychogenic erections are caused by sexual arousal, either from physical or mental stimulation. When a person becomes sexually aroused, the brain releases neurotransmitters that stimulate the blood vessels in the penis, causing increased blood flow and resulting in an erection. For people with erectile dysfunction, psychogenic erections can be an important diagnostic tool. If a person is able to achieve an erection during sexual stimulation, it suggests that there may not be a physical problem with the penis, but rather a psychological issue causing the dysfunction. In this case, Therapy or counseling may be recommended to address the underlying issue. Mental health disorder in relation with erectile dysfunction. Mental health disorders can have a significant impact on a person's sexual function, including the ability to achieve and maintain an erection. The connection between mental health disorders and erectile dysfunction, ED, can be complex and multifactorial. One way in which mental health disorders can cause ED is through the impact they have on a person's mood and self-esteem. For example, depression and anxiety can cause feelings of worthlessness or low self-esteem, which can reduce sexual desire and impair the ability to achieve an erection. Similarly, stress and anxiety can cause physical symptoms, such as muscle tension and increased heart rate, which can interfere with sexual function. Another way in which mental health disorders can cause ED is through the effects they have on the body's hormonal system. For example, chronic stress can lead to an increase in the stress hormone cortisol, which can interfere with the body's production of testosterone, a hormone that is important for sexual function. There are a number of benefits to addressing mental health disorders in the treatment of ED. For example, treating depression or anxiety can help to improve mood and self-esteem, which can in turn improve sexual desire and the ability to achieve an erection. Similarly, reducing stress and managing anxiety can help to reduce physical symptoms that can interfere with sexual function. While there is no doubt that psychological factors can play a significant role in the development and persistence of erectile dysfunction, it would be inaccurate to suggest that ED is always all in your head. While psychological factors can exacerbate or even be the sole cause of ED in some cases, it is important to recognize that this is not always the case. Seeking medical advice and treatment can help individuals with ED to identify the underlying causes of their condition and explore appropriate treatment options. If you found this video helpful, make sure to like this video right now, subscribe to this channel and hit that bell button for more tips on erectile dysfunction. Also, don't forget to check out the simple, easy exercises that drastically increase stamina and heal erectile dysfunction from the privacy of your own home by clicking the link in the description. Thanks for watching and see you in the next video.